okay. I think, yes, I traveled home to go and see my parents. And I just got back to Lagos yesterday. So I said, let me come online so we can talk about pregnancy rhinitis. Have you heard of anything like that? There's no problem. You can join me. I know my fans will soon be coming to join me, to listen to me. It's been a while here. Missed you guys. Do I posted some shorts about pregnancy, about the three tribes in Nigeria, how they react during labor: Yoruba, Hausa, and Igbo. And I said that the Hausas, they have high threshold of pains. They don't usually shout like that during labor pains. Whatever it is, please do whatever you know you can take. Don't say because you don't want to shout and you are suffering. Please shout if you have to shout. Because even me as a midwife, I shouted during my own labor before I had my daughter. So this afternoon, I want to talk about pregnancy rhinitis. What it is. What is this pregnancy rhinitis? Pregnancy rhinitis is a nasal congestion, stuffy or runny nose that develops during pregnancy without any infection, allergies, or other known causes. And it usually starts in the second or third trimester and goes away within 2 weeks after delivery. That's why I used to tell people that pregnancy is not something you have to joke about. Women, our body go through a lot of things. You will see some women when they are pregnant, the nose will be very big. You will see some people, they will have acne all over their body. You will see some people with eczema. You will see some people with striae gravidarum all over their body. It's still part of the hormonal changes in our body during pregnancy. And that's why I always tell women that please take care of yourself. Make sure you have a very good pregnancy journey. Even if when you are going through these things, make sure you eat very well, you rest very well, you hydrate yourself very well, because pregnancy is stressful on its own. I pray that God will make it easy for each and every one of us in Jesus' name. So just like I said, it's a nasal congestion, stuffy or runny nose that develops during pregnancy without any infection, without allergies or other known causes, and it usually starts during the second trimester or the third trimester of pregnancy. You just see that every time your nose is always blocked, you are always having runny nose. That is pregnancy rhinitis, rhinitis. And it can happen to any woman during pregnancy. So what are the causes of this pregnancy rhinitis? That as soon as you enter the second trimester to the third trimester, your nose will never get dry. Sometimes it will be blocked that you can't even breathe well. It's as bad as that. So when you have this, let me share some of the things that I know that can cause it. Hormonal changes, there's increased level in estrogen and progesterone, and this can cause swelling of the nasal tissues and increase mucus production. So you see, when a woman is pregnant, so many things goes on in her body that even she herself cannot explain. And that is why when a woman is pregnant, she needs a lot of support from her partner, from her husband, from her family, because the body go through a lot of things. Please, if you are welcome, please help me to like this live streaming, because it's a very interesting topic. Thank you. I can see like 9 people. So hormonal changes during pregnancy. You see, we women, our body is just like an engine. After finishing giving birth, during menopause again, we start wahala. I remember 2 years ago when I started feeling this signs of menopause. I would be sweating like a Christmas fowl. Sweating. I can't even make up. Because if I make up, even I on AC in my car, I will still be sweating. I said, God, what was wrong with me? So we see that, just like I said, number 1 cause is hormonal changes, because there's increased level of estrogen and progesterone. And these tend to make the nasal tissues to swell, and this will increase the mucus production. Then there's also increased blood volume. Blood flow making nasal passages more congested because of the hormonal changes. There's so many changes in the body, and this can also affect the nasal passage, the nasal tissue, and this can make congestion to occur. Then there's relaxation of smooth muscles. Hormones relax airway muscles, leading to swelling. Still, everything still comes back to hormonal changes during pregnancy. So what are the signs and symptoms of this uh, pregnancy rhinitis? We have you always see that your nose is always stuffy, your nose is always blocked, you are always having running nose, your nose is never dried, you are always with handkerchief, and you be sneezing everywhere. It's because of this pregnancy rhinitis. It's a very serious case, but the one thing I love, I can say about this pregnancy rhinitis is that it's not something that can affect the baby or the mother. It's just that maybe when she wants to sleep in the night, she may find it difficult because of the blocked nose, and with some other things that I'll be telling, she will feel a lot of relief. Postnatal dawn, mucus dripping, and this also worsens at night, especially when lying down, and can cause snoring and disturb sleep. You know, when you are not breathing very well, you will not be comfortable, and so there are many things you can do that can bring relief to you. So how can it be diagnosed? Number one, you have to rule out whoever you are seeing, have to rule out common cold, flu, sinusitis, or allergies. These symptoms only last for 6 weeks during pregnancy and resolve like 2 weeks after birth. Your nose will be clear. You will be wondering that, I didn't do anything now. So what happened? That is pregnancy rhinitis for you. Your nose will always be blocked, and you can't say this is the cause. Then what are the management and the treatment? We have non-drug option, and they are the best during pregnancy. You know, I used to say that during pregnancy, it's not just any medication you can take, because a baby is growing inside of you. You can't go and take medicine that will affect the growth of the baby. There's this drug that time they taught us in school, thalidomide, that when a pregnant woman take this drug, can make the baby to lose one or two parts of the baby's body, may not develop or may not form well. So it's risky for you as a woman to always go on self-medication. So most time this thing, even without taking drugs, it will resolve itself. So, and you have to make sure that you have a lot of lifestyle and home remedies, like sleep with your head elevated. As a pregnant woman that you are experiencing this pregnancy rhinitis, you have to make sure that your head is well tilted up while sleeping, so that the mucus will not go and block your airway. Then you have to use humidifier to moisten the hair. Make sure the hair in your room is well moistened to prevent every time your throat will be dry. Then you can take warm showers and steam inhalation. We all know steam inhalation. You can even do it on your own. You can boil water. You can, just cover yourself and inhale that warm water. It will clear your airway, and it will also loosen the dry mucus, and this will be easy for you to flush it out. Then always make sure you are always well hydrated. Take enough water. Take enough water, and exercise regularly improves blood circulation. So what are the medical options if severe? And this should be on doctor's advice. You have pregnancy rhinitis, don't take law into your hand. Don't just say, let me go and take Procode. No, please see your doctor. See your doctor and make sure everything is fine. And this medical option, if severe, that is when they can give you saline nasal spray, and is safe and effective during pregnancy. Nasal corticosteroid prescribed if symptoms persist. Avoid the congestants, especially in the first trimester, because the first trimester, the baby is still forming. So there are some drugs that a pregnant woman should not take. So what are the complications of this pregnancy rhinitis? It's usually harmless, so nothing will happen, but can cause sleep disturbance because of that nose that is blocked. The pregnant woman may not be able to sleep very well in the night. She can even be breathing through her mouth, because I know we must have experienced it, even if you are not pregnant. When your nose is blocked with catarrh, you won't be able to breathe well. Sometimes you have to open your mouth for you to be able to breathe well. So also a pregnant woman that is experiencing this pregnancy rhinitis can also feel like that. And during daytime, the patient can be fatigued and may worsen sleep apnea in some women. Yes, sleep apnea is when you are snoring, because your nose is blocked and you are trying to breathe as much as you want. You want it's because the nose is blocked. So that steam inhalation, it helps a lot when you do it. When you have this pregnancy rhinitis, you can always do that steam inhalation, and you will see that your airways will be clear and you'll be able to breathe well. Because this thing, most time, it will resolve 2 weeks after delivery. It will go on its own. You don't have to use drugs or anything. Like me, even that I'm not pregnant, I have cold most of it. But the only sickness I know I used to have is this catarrh. You can even feel it because I went for a program last week. So, and anywhere that so many people are, it's possible for you to have this catarrh. So my nose has been blocked. I took drugs, but it's not resolved. But I know that eventually it will go. Or you get better pepper soup in our African way. Take it, and you will see that you'll be sneezing well, and all the nose that is blocked, everything will be open. So pregnancy rhinitis is very common, but it's temporary. And it usually disappear after delivery and doesn't harm the mother or the baby. You see what I said? It will not harm you and it will not harm your baby. The only thing is just the inconvenience. Maybe when you are sleeping, you cannot close your mouth, your nose is blocked. And with what I told you, if you follow all these things I told you, that you can do steam inhalation, you can use the humidifier, and you can exercise regularly, take enough water. Taking of this water is very important. Either you are sick or you are not sick, either you are pregnant or you are not pregnant. Well hydrated human being is good, because water itself is life. So you have to do this. It's not every time that you are sick as a pregnant woman that you have to take medications. Most of these things are caused by hormonal changes in your body because you are pregnant. So that's it for the pregnancy rhinitis. I said that it worsens at night when lying down and can cause snoring and disturbed sleep. But it doesn't have a major complication that can affect you or your baby. No. You can do home remedies. Just like I said, sleep with your head elevated. Use the humidifier to moisten the hair around you, and everything will be fine. So that's it for pregnancy rhinitis. Then I I have the video on my wall there about the final destination of placenta. I made the video today. I posted it on my TikTok. I think tomorrow I'll post it on my Instagram and Facebook. And that video, the summary of it is just that most people, they are only after the delivery of the baby and the mother to be okay. But there's one major thing that is important. The placenta need to be delivered at I think within 10 to 15 minutes, the placenta should be delivered. And if it's taking longer than that, it's very dangerous because the clients can be bleeding, and postpartum hemorrhage is a very risky issue that no health worker or midwife will joke about that. So I was saying in my video that every birth has a story, and we often celebrate baby's first cry. But there's another hero in the journey, and that is the placenta. Placenta delivery is very important. It's during the third stage of labor that the placenta is delivered. After the baby is born, the baby has, I said the body has one more role to play, delivering the placenta, and this is called the third stage of labor. Sometimes the placenta come naturally. Some people, you don't have to stress yourself. As soon as they deliver, in fact, within few seconds, the placenta will follow suit, and the placenta will be delivered and without any problem. But sometimes a midwife or doctor can assist, making sure that everything is safe with both the mother and the baby. Because third stage of labor, if it's not well managed, it could lead to serious complications. It could lead to postpartum hemorrhage. From postpartum hemorrhage, the clients can go into hypovolemic shock. So many things that can happen during the third stage of labor, and that is why it needs to be managed well. When whether you are a midwife that you are managing the third stage, you have to be very careful. And the placenta delivery may be very quiet, unlike the baby. Push the placenta. You don't have to tell the client to push. You deliver it gently. And sometimes, even as midwife, we do manual removal. We see that it's not coming when it's supposed to come. It's going to 25-30 minutes. You can do manual. Just make sure you wear a glove that will cover your hand very well, and just guide your hand gently into the uterus and scrape it from the uterine wall and bring it out before you give the client a ergometry injection that will make the uterus to contract very well and prevent a postpartum bleeding. So, but it is powerful and it marks the chapter of that pregnancy. You see, when a placenta is delivered, that pregnancy journey is already terminated. Thank you for the like, 3 likes. Thank you. Please like this more. All these people, I can't read what is written in front of you because it's Arabic. I'm a Nigerian midwife, so I can't read it. But you can just help me like the live streaming. So when the placenta is delivered, that pregnancy is already terminated. Everything, the baby is alive, everything is okay. So that's the end of the third stage of labor before you now clean the woman up, take care of her, whatever you want to do for her before you take her to the recovery room for her to rest uh, after just having a baby. And you know, one thing with midwife is that we work with mothers through every stage, from the first heartbeat when she came, the first time she came for antenatal. She walked into your clinic that she's pregnant and she wanted to register for ANC. From that first heartbeat that you had till the final joining of the placenta. You know, midwives, we are great. We are lovely. We walk you through for 9 months. We are your best friend. Even abroad, plus you see that midwife they have autonomy. You know, as a pregnant woman, you don't just go and see doctor abroad. You go and see your midwife because she has been trained very well in this midwifery, and she knows what and what to do for you to be healthy, for you to be okay. The advice she will give you during this pregnancy until you deliver, except if there are serious complications, serious issue, before she will refer you to the doctor. But a midwife has that power of autonomy to treat you from your first day in the antenatal clinic till you give birth in the maternity ward. So this is very important. If you find this helpful, please share it with a mama to be and follow the Fashionable Midwife for more wisdom on pregnancy journey and birth. Please subscribe to my channel, and I will subscribe to yours, because I talk about pregnancy, I talk about newborn, I talk about postnatal, I talk about when to resume sex after having baby. So many things that I talk about here. The other time I talk about abdominal pain in pregnancy, the warning signs, so many things, preeclampsia, after PIH, pregnancy induced hypertension. All these things I've dealt with them in my videos, and if you check my wall, you will learn so many things that can be useful to your wife, that can be useful to your friends. You can get some things that you will get something out of it, that this woman's channel, I'm learning so much from it. The other time I made a live stream, one man said that his wife is one of my subscribers and she doesn't miss my video or anytime I live stream. So please subscribe and follow me on this channel for more juicy educative videos on pregnancy, on newborn, and so many things that concerns a woman's pregnancy journey. We admonish safe motherhood, safe pregnancy, midwife tips, and all these things will help your person to have good testimony after delivery. So if you have any questions, you can drop it in the comment section and I will do justice to it. So we talk about pregnancy rhinitis, and I also talk about the placenta final journey. And as a woman, I will say one thing. I always say it anytime I come online or I make video, that please, you are the one going through this thing. Please always listen to your body. It's very important. Listen to your body. If anything is off, if anything is not right, please speak up. Go and see your midwife. Go and see your doctor. Whatever we say here, we are saying it, but you are the one feeling it. You are the one having issues with your health. So you need to speak up so that you will get treated and everything will be fine. Prompt intervention is very important. I say this all the time. And I pray that you will deliver like the Hebrew women. So I have to go now. Thank you for joining me. God bless you.